Gum disease affects nearly 90% of adults globally, yet most remain unaware until severe symptoms appear. Often mistaken for minor irritation, early-stage gingivitis progresses silently. Studies show that 3 weeks of neglected oral hygiene can trigger irreversible bone loss. This preventable condition is the leading cause of tooth loss worldwide, surpassing cavities. The World Health Organization categorizes severe gum disease as the 11th most prevalent global health issue. Plaque bacteria secrete toxins that trigger our immune response, causing gums to swell and bleed. Microscopically, white blood cells attack these invaders, creating pus pockets. Research from the Journal of Dental Research confirms that Porphyromonas gingivalis, a key pathogen, can enter bloodstream through ulcerated gums. These bacteria produce enzymes that degrade connective tissues at 0.1 millimeters per day. Chronic inflammation also elevates systemic C-reactive protein levels by 30%. Bleeding during brushing isn't normal. It's stage 1 gingivitis. Other red flags include persistent bad breath, halitosis, caused by volatile sulfur compounds from bacteria. The American Dental Association notes that 50% of adults dismiss gum sensitivity as temporary. Advanced symptoms involve tooth mobility and gum recession exposing roots. A 2023 meta-analysis found these signs typically appear 8.2 years after initial inflammation begins. Harvard School of Dental Medicine links periodontitis to 45% increased cardiovascular risk. Bacteria from gums travel through arteries, triggering plaque formation. Diabetics with gum disease experience 30% worse blood sugar control, per Journal of Clinical Endocrinology. The National Institutes of Health confirms oral pathogens in Alzheimer's brain plaques. Pregnant women face 7x higher preterm birth risks with untreated gum issues. Myth 1: bleeding means brushing too hard, actually indicates disease. Myth 2: gum loss is genetic. 90% is preventable through hygiene. The International Dental Federation disproves myth 3: chewing gum cleanses teeth, only reduces acidity temporarily. Surprisingly, 68% of patients believe these misconceptions according to Journal of Public Health Dentistry surveys. Even whitening toothpastes often lack essential anti-gingivitis ingredients. University of Toronto research confirms proper brushing reduces plaque by 70% in 14 days. Technique matters more than tools. Angle bristles 45 degrees toward gums using gentle circular motions. Interdental brushes remove 40% more plaque than floss, per European Journal of Orthodontics. The magic duration? 2 minutes twice daily. Most people average just 45 seconds. Nighttime cleaning is critical as saliva production drops. Vitamin C-rich foods, bell peppers, kale, boost collagen production for gum attachment. Omega-3s in walnuts decrease periodontal inflammation by 23%. Nutrition Journal. Crunchy apples act as natural scrubbers. Surprisingly, green tea catechins inhibit P. gingivalis growth by 50% of periodontology. Avoid acidic drinks. A pH below 5.5 erodes enamel, worsening gum recession. Chewing xylitol gum increases protective saliva flow. Cortisol from chronic stress impairs immune response to oral bacteria. Bruxism, night grinding, accelerates gum recession. 20% of adults unknowingly grind, Journal of Oral Rehabilitation. Mindfulness practices like 10-minute meditation lower inflammatory markers by 17%. The American Academy of Periodontology recommends diaphragmatic breathing before bed to reduce clenching. Surprisingly, laughter increases infection-fighting immunoglobulin A in saliva. Gum health mirrors whole-body wellness. Tokyo University's study shows interdental cleaning adds 1.7 healthy years. Scandinavian countries' public health campaigns reduced periodontitis by 60% since 2000. The Swiss Dental Journal advocates tongue scraping removes 30% more bacteria. Most compelling? A UK trial found improved gum health, lowered systolic blood pressure by 13 points in hypertensive patients. Commit to morning-night routines for 3 weeks. The time needed to reverse early gingivitis, Journal of Clinical Periodontology. Track progress with gum selfies to monitor color changes. Use a plaque-disclosing tablet weekly to identify missed spots. After 21 days, most report 80% less bleeding. Remember, healthy gums shouldn't bleed when probed. Share results to inspire others. Oral health is public health.